So
they're just sleeping.
They're just sleeping. It's a deep sleep, and they will come back after some time. It varies. Some people within just some 3 minutes. Some people within 20 minutes. So it varies. They will come back. If we know the person's seizure types, and we know this is what the person does whenever they have a seizure, then this is the approach. If you do not know, or if it is the first time the person has had a seizure, then you bring them to hospital. In the UK, they will say call an ambulance, but in Ghana, I would just say bring
the person to hospital.
To hospital, yes. So that is what has to be done. There are things that we do not have to do. Don't force to bring them back. See some people shaking the child, trying to bring them back. It doesn't help. It rather causes a lot of injury sometimes. Yes, and then don't restrain them. Sometimes too, we see they are being restrained. We are pinning them down.
Yeah, like
yes,
people hold them down.
You down. Yes,
but isn't it a natural response? Because the person is the person is jerking so violently.
Yes, but it's you can't stop it by
holding the person down.
You rather cause more injury. I've seen trauma, various forms of trauma, fracture and dislocation, especially from being us restraining somebody from having a seizure. So we don't have to do that. Then we don't have to apply any substances. A short study that we did at the hospital showed various forms of substances. Even though garlic is very common, yes, we have other forms of substances, and substances that people also think have spiritual powers, like oil, anointed oil, holy water. People will do all sorts of things.
It doesn't work.
We don't have to do that. Let's not apply any substances, especially those harmful ones. So I always talk about the harmful ones: garlic, ginger, pepper, oil. Those are harmful ones. And then you don't have to turn the child upside down. People think that when they are having a seizure and you turn them upside down, then a lot of blood goes into the brain. It is the science behind it is good, but in practical terms, you cause a lot of injury to the child. The child is likely to aspirate on their own secretions if you turn them upside down. God has made it in such a way that at the time they are having seizures, the whole body shuts down some way, somehow, and then focuses on sending blood to the brain. So already there is a regulatory mechanism that makes sure that the brain gets a lot of blood supply. So you don't have to add to it by turning them upside down. Then people also force things into their mouth, especially glucose drink, anything that has Coke, Fanta.
You're just pouring it down.
Yes. It is not a good practice, especially when the child is actively having seizures or has just finished having a seizure and is in a post-ictal sleep. You are likely to cause them to aspirate. Aspiration means they will swallow or drink into the lungs instead of drinking into the stomach. You are likely, and that is likely to cause more danger, more harm than the seizure itself. We should wait. If we think that because they are hungry, that's why they are having seizures, that is not very common. It usually happens to people who are sick. What we call hypoglycemia happens to people who are sick. They have severe malaria, for example. So those ones are usually in hospital. And then in hospital, what we'll do is that we'll check their blood sugar, and then we'll determine if they need to be given glucose. Yes. Then that one too, we don't pass it through the mouth, we pass it through the vein. That's why I said it is good to bring the child or the person to hospital. And then the most important thing, don't give them anything to eat unless they are awake and they themselves say, I want to take something. I'm hungry, I want to take something. Yes, but most of the time it's not because of hypoglycemia in the community setting. It's usually in the hospital setting that you say it's hypoglycemia. In the community setting, most of the time it's not hypoglycemia. And then more importantly, stay with the person until the seizure is over and protect them. Yes, let's remember it is not contagious.
It's not contagious. That's really some good information there. We're 51 minutes past 8 o'clock here on 107.9 Orange FM, and this morning we're talking about epilepsy. And like Dr. Hammond has eloquently said, it's not contagious. If you see somebody having a seizure in open, in public, at home, at school, protect them from the immediate environment. So sometimes you have tables, you have chairs, sometimes you have the floor, turn them on their side and wait for the seizure to pass. Don't restrain them, don't pin them down, because that can cause fractures, that can even cause more injury. Allow the seizure to pass and then send the person to hospital. Good morning to you, SM Creative Stitch House. I'm saying that doesn't mean that children that normally get convulsions are epileptic. This is also there.
Yes, so before we say that a person has the disease called epilepsy, we must be sure that the seizures are not provoked.
Okay.
So if a child is having convulsions which are caused by infection or fever, that is provoked.
Okay.
And so the child doesn't have epilepsy. So if you keep having what we call febrile seizures or febrile convulsions, it doesn't mean you have epilepsy. But again, I must say that some epilepsy types will start as febrile convulsions. So especially if they start very early in life, some epilepsy types will start as febrile convulsions. So it is important that you let a doctor evaluate the child to determine if this child falls into that category or not. But most children with febrile seizures or febrile convulsions do not have epilepsy.
Okay, so SM Creative, that is for you and everybody else who is thinking about it. That is the information for you. We have another message. Okay, so Doris is saying that the challenge with epilepsy is that everybody has an opinion as to what you should do and how you should manage it. Says that my child had epilepsy. He said my child had epilepsy. Okay, so your child had seizures, not epilepsy. Seizures, and later was diagnosed with epilepsy. We are now on medication, and the child has not had a seizure in a long time. Kindly tell your listeners that epilepsy can be managed very well, and that parents should be more aware that these things can happen to anyone. All right. So thank you very much.
Yeah. So that is a story. That's a story I want to hear. The child had seizures or had epilepsy, has been put on medication, and is doing very well. But what I want to add is that she says I should tell listeners that epilepsy can be managed. I really want to say it can be cured.
Oh, really?
Yes. Many people have been cured of their epilepsy. Yes, it's a disease that can be cured. Yes, so it's not just a matter of managing it. What we are aiming at is curing your child. Yeah.
So for those who are asking me, can it be cured? Can it be cured? Can it be cured? I've received a lot of those questions. Someone's also asking, can people die from epileptic convulsions?
Yes. Especially if we don't give them the help they need. We stand and look and think that they are demon possessed. Yes, they can die from their own being choked by their own secretions. And then also some people have epilepsy. They have seizures once a while. Maybe in 3 months they have one seizure. It goes off. Then another 3 months, and then 6 months, and we don't bring them to medical attention, so they are not put on medication. We don't know the day they will have a very bad seizure. There's a seizure type called status epilepticus. It's a very bad seizure, which can be so prolonged, difficult to stop, even in hospital, and the outcomes are usually not so good.
Okay.
Yes. So don't say, "Oh, my seizures are just brief, so I'm not on medication." Yes. Unless the doctor has advised that for this type of seizure you don't need to be on medication, but don't on your own say that, because you never know when you will have this very bad seizure called status epilepticus. It can be fatal.
So let me read Kojo's message. Good morning to you, Kojo. Thanks for always doing the listening. Kojo is saying that there was this guy around Edum, usually around banks and ATMs. When you withdraw money and he sees you coming, he would lie on the floor and start jerking. So he's saying that there are also people who fake it. So well.
This is a nice story.
Yes,
I never heard this one before.
Well, I mean, to confirm Kojo's story, I have met that person before.
Oh, okay. When they see that you have withdrawn money.
Yes, I've met that person before, and
wow.
I insisted on going to buy him his medication instead of giving him the money.
Okay.
And then he walked away.
Okay, he's not interested.
He's not interested. So I have seen this person before, and it's something that. But when somebody is having, when it's in the public or it's in the open. I wish that they teach some of these things, even on television for people to know how to handle, emergency situations. And like Dr. Hammond said, when it happens, maybe at home, at school, at church, wherever. As soon as the seizure passes, send the person to hospital.
Yes.
Even if they are known epileptics,
yes,
send them to hospital.
It's always advisable, especially if the reasons to send them to hospital, especially if it is their first ever seizure.
Okay.
And then 2, if it is too prolonged.
Okay.
And then 3, if they have hurt themselves in any way.
In any way.
Yes.
Okay.
Prolonged means it is prolonged beyond what they are noted to have.
Okay.
Some people have seizures. They know themselves. They are on medication. Yes. So okay, probably I skipped my medication last night and I just had a seizure now. Yes. But if it comes and it is so prolonged, that is a reason to send them to hospital. And also, if you do not know the person, it is a reason to send them to hospital. Because then you wouldn't know of all the background information that we are talking about. Yes.
Someone also wants to find out, are there any, I don't want to say, are there any benefits? I know that's what he's asking, that when people have repeated seizures, are there any benefits that the brain gets from having repeated seizures?
No, not that
I don't think
that
so.
I know of.
Yes.
It's rather harm. Every seizure you have has a potential to cause damage to your brain. No seizure brings any benefits. Yes, so I don't think there are any benefits from having seizures.
So, boss, if someone is listening to us and maybe a person has had a seizure, when you go to hospital, what should you say? Like, take us through how the consult should be, because if it's one seizure, you don't know whether you should follow through. And sometimes they say, "Oh, it's very brief. Oh, it's very short." So this one, it's nothing. You don't have to see anybody about it. At what point do you say, "I'm going to the hospital"? When you get there, what do you even say?
So one of the things they will ask you, most doctors will ask you a lot about the seizure. Okay, some people can sense that their seizure is about to come, especially if they've had it over and over again.
Oh, okay.
Yes, we have something we call aura.
They can sense it.
Sense it.
Wow.
Yes. So the doctor will ask you, are you able to sense that you're about to have a seizure? Some people say no. Some people say yes, because there's a particular feeling they have, which is always followed by the seizure.
Oh.
So some children will tell you they hear loud noise in their ears just before the seizure comes. So if you are a parent, for example, I'm sure you have probably witnessed that before your child has a seizure, they often run to you.
Yeah.
Their children don't have the vocabulary to tell you,
I'm about to have a
seizure, but they run to you for safety, for comfort, because they know they're about to have a seizure. They've had that feeling before. We call that an aura.
Okay.
Doctors will ask you about the aura. Then doctors will ask about how the seizure showed up. Was it only one arm, one leg that was jerking? Was it the whole body that was jerking? Was the face involved? And this is usually information we want to get from an eyewitness, somebody who saw the seizure. So if you saw the seizure, these are some of the things doctors will ask you. They'll ask you, how long did it last? That's a very difficult question to answer, because nobody takes a stop clock to time when their child is having a seizure. But it is just a rough estimate. But again, if you are a parent and your child has a seizure for 2 minutes, it might look like 1 hour to you.
Yeah. I can only imagine.
It's such a traumatic experience. It might look like 1 hour to you. Yes, but if the child has had it over and over again, and I always tell the doctors I work with, we have a way of helping the parents tell us roughly what the duration looks like. These are all important because it gives us an idea what seizure type the child has. And based on the seizure type, we know the medication that will work. There are so many anti-seizure medications. As of now, there are about 26 or so of them.
Wow.
Yes. And not every one of them will work for
everyone.
Every seizure.
Okay.
Yes. So when we ask all those questions, we are trying to find out what seizure type you have and which anti-seizure medication will be suitable or will be appropriate for your seizure type.
Kojo comes back once again. He says that he has a colleague. I have a colleague in the office who sometimes goes off into brackets. They will stare at you for a long time. Even when you talk to them, they cannot respond. And I read somewhere that could be a seizure that he's having.
Absolutely. It could be a seizure. So that's another type of seizure. If you remember when I tried defining seizure, I said some of them will just stare into space.
Hey, then the person's a driver, they are.
Yes, that is a problem. So, so some of them will just stare into space. It is a type of seizure we call absence seizures. In the past, we used to call it petit mal.
It has changed there.
Yes.
Ooh.
Petit mal is a French word for seizure.
I used to like that expression.
the small disease.
Yes,
but it's not small like that. That is why we no longer use.
So we call them absence seizures.
Absence seizures.
Okay.
Yes. So that could be an absence seizure. But there are so many other reasons why somebody will stare. It is not only absence seizures. Some people actually also have a type of seizure called focal seizures. Focal seizures, only one part of your body jerks. But some people, they will not jerk at all. They will just stare. Okay. So when they stare, most of the time it's absences. But on a few occasions, it could be focal seizures. It can also be daydreaming. Yes.
It can be daydreaming. or the guy is thinking about something else.
Thinking about something with all the pressure.
With all the pressure in the office. Because are you sure your colleague is not just like zoning out? Sometimes you just want to zone out.
So he needs to be evaluated in hospital, and then we'll be able to tell if it's a seizure or not a seizure. Yeah.
Okay, we'll come to the evaluation a bit, but I keep getting this question about trying to probably bust the myth that are there any particular foods or drinks that are implicated in causing seizure?
No.
None.
No. There's no food that will cause your seizure. The commonest I've heard is okra. Oh. Yes. People.
All the banku eaters.
Yes, who are having seizures, some way, somehow, they are told to abstain from okra. Snails, which is the delicacy for some people.
Yeah.
Yes. Some people have been told to abstain from it because okra and snails, I think because they are slimy.
Because of the slime.
Yes, people think that's is a quick way of making your seizure come back or something.
Okay.
I've also heard people say that children who have seizures, different people say different things. Children who have seizures should abstain from sugar. I've heard about egg.
Okay.
I've heard about meat, different kinds of foods. And if we are not careful, we just deprive the young child's brain of essential nutrients.
Yeah.
These are all myths, and they don't trigger seizures in any way.
Okay. Can lights, can flashes trigger seizures?
Yes. So we have some people whose seizures can be triggered by certain activities. So these are called activating factors. They trigger your seizures. Some people, flashes of light.
Yeah.
Yes, flashes of light can be a trigger for their seizures. So some people will go to an event, discos, where there are a lot of flashes of light, and that is where they have their first seizure.
Wow.
Yes. It's because flashes of light into the eye can trigger this abnormal electrical activities.
Okay.
For some people, it's sleep deprivation.
Oh.
Yes. So for those in schools, secondary schools, the universities, usually they tend to have their seizures during examination period because they are sleeping less.
Okay.
Yes. So sleep deprivation is one other common trigger of seizures.
Papa was telling
And
like,
then for
we're
some
going to
people
write the
also-
missem. The missem. I
Yes.
haven't learned enough. I have
So
to.
yes.
Wow.
That's why you must know yourself and you must prepare from way ahead.
Hey, Dr. Hammond, you know, sometimes
I know. And then for some people also, sleep itself.
Sleep
So
itself.
when they go to sleep, like some people always have their seizures when they go to sleep.
Oh.
So when they go to sleep, especially children, usually it is between the time from the transition from awake to sleep, or from sleep to awake. So just when they go to sleep, or just when they are about waking up, then they tend to have their seizures. Those ones, there is very little you can do about it except to take your medication. Yes, but the sleep deprivation, that one you can avoid it by making sure that you have adequate sleep. 8 hours for an adult is fine. If because of exam or something you want to come to 7 hours, that is fine. But when you come down and you are sleeping 4 hours, 3 hours, you are actually putting yourself in harm's way.
People are asking very, very funny questions, and I'll come to them in a bit. But I have a message for all foodies in Kumasi. This one is for you. Our favorite tomato mix, Pomo, comes to us with Pomo Mukasira Challenge, and it's been a battle of flavors. And now we're bringing the excitement closer to you at your favorite hangout spots for an even bigger foodie experience. So bring your squad, get ready for delicious meals made with Pomo tomato mix at discounted prices. So, you know, there's a calendar, so you might want to take a pen to write this down because the food train is going all over Kumasi. So today, 1st of March, they're at Aponchechi in Ejiso. Then on 6th March, that's next week, they're at Ike's Cafe, Bantama. On 9th March, they're at Confidence, Ahojo. And then on 16th March, Barnas, Ahojo. Bring your appetite and come and taste with love with Pomo tomato mix. So if you're big on food, trust me, Pomo has got you sorted from now to the next about 2 or 3 weeks. And then, you know, they're all around, you know, they're all around. So try your best to join the Pomo foodie train. We mentioned this earlier, but maybe the person did not get it, that epilepsy happens at the extremes of age, and then there can be a genetic component if it's there. So don't worry too much. Someone is saying that his mother has never been epileptic. She had a stroke, and then later she became epileptic.
Yes, so that is it. That is why we talked about the extremes of age. For older people, insult to the brain is a very common cause of epilepsy. So when you have a stroke simply means that blood supply to parts of your brain was cut off, either because the vessel was blocked or there was a bleed. So when you have a stroke, a part of your brain tissue becomes like a scar.
Okay.
And that scar becomes a focus for abnormal electrical activities, which can then let you have epilepsy. So epilepsy can happen post-stroke.
Post-stroke.
Yes.
So even
sometimes,
if somebody had, let's say, like a head injury,
yes,
you can become epileptic after.
Yes, after head injury, you can become an epileptic. After stroke, you can become an epileptic. After a brain tumor, you can become an epileptic. So these are the reasons why older people have epilepsy. Okay, most older people who have never been epileptic, it means they don't have any genetic predisposition. So as they go through life, all the stress we are exposed to, the infections and all those things, these are the reasons older people are at increased risks of epilepsy. For younger children, it is usually genetic and metabolic causes.
Can you lose your memory, or can you have some kind of a memory loss after epileptic seizures?
Yes. So the brain is a very complex organ. Various parts of the brain do various things. So you have a place where memory is stored in your brain. If that becomes the focus of your seizure and it's not well controlled, it can affect your memory.
Wow.
Yes. So if you have seizure from a focus which is supposed to be your memory bank, for example, then it can affect your memory. Yes. So
how are neurologists wired into antenatal care? I'm asking because there's a question about when someone is pregnant and they are established as epileptic. The management can be funny. It can be either easy depending on where you are, or it can be totally ignored.
Yes.
When somebody is pregnant and they're epileptic, are there any? What would you advise?
So yes. So let me start by saying that in women, sometimes hormonal changes for those who are predisposed to
epilepsy.
Okay. Some hormonal changes can also be a trigger. That is why some of them tend to have their seizures always with their menstrual flow.
Okay.
Because of hormonal changes. Men, we don't have that because our dominant hormone is testosterone, and the level is the same throughout our adult life. For women, they have what we call estrogen and progesterone. And sometimes you have changes. At different times of the month, you have different levels of estrogen and different levels of progesterone. Yes. So the same happens in pregnancy. One of them is usually on the higher side. If for a woman, when that one is on the higher side, it becomes a problem. Usually I've had patients who have become pregnant before, and it's not a big deal if you stick to your medication. Yes. It's not a big deal at all. I've never had any of my patients who go on to become pregnant have seizures
in pregnancy.
As long as they stick to the plan. Sometimes, because of the pregnancy, we might have to modify the medication a little to take care of your increase in fluid retention, your increase in weight, and other things. But we work very closely with the obstetricians, and when the obstetricians also encounter a pregnant woman who is known to have epilepsy, they also contact us, and then we work closely with them. And when we also have patients who have epilepsy who get pregnant, we also refer them to the appropriate obstetricians.
How do we? I know. I have referred many patients to you, and sometimes even the counseling of adults, especially when it involves children, to accept the diagnosis of epilepsy is very difficult.
Yeah.
Sometimes it's the adults who are in denial. It's not the children.
Most of the time. It's not sometimes, it's most of the time.
Does that delay when care can be started for the children?
For epilepsy, most people want to see it stop.
Cured.
Now, today. Yes. So they will do whatever you tell them to do. But that also makes them vulnerable to many other unnecessary interventions. Yes. So because they want it stopped now, they want it stop. They don't want to see it again. They also become vulnerable to other unnecessary interventions. Somebody will tell you, go and bring chicken, and then they will bring it. Another person tells you, go and catch a lizard, and then they will go and do it. So it is how vulnerable they are, because they just want
the epilepsy. Yes. They just want a solution to the problem.
Yes. But there are other neurological conditions. Maybe one day we'll talk about autism and other things where people are often in denial, especially parents.
Yeah.
And usually sometimes you have one parent accepting that there is a problem, another parent saying, oh no, He's a boy. Boys don't talk early. You know, that is how I was. My mother says I didn't talk early,
so
yeah. Yes, so some people, sometimes treatment is delayed because parents are in denial.
Yeah.
But usually we don't see that with epilepsy. Yeah, they just don't want to see
just
seizures again. So rather they over-treat with
Yeah.
all sort of herbs, and sometimes they move from one doctor to the other. As I said, there are about 26 medications that we use to treat epilepsy. If one doesn't work for you, it doesn't mean it is not a hospital disease. It doesn't mean
the doctor doesn't know what they are doing.
You have to go back to the doctor for reevaluation. But you see people move from one doctor to the other. I've had patients who are taking the same medications but different brands.
Ooh.
So they are taking double doses of the same medication because they saw this doctor who wrote this medication and they saw this doctor who wrote that medication. And in our minds, okay, let's try.
Let's try the two.
One of them will work, but apparently they were the same medication but different brand names. Yeah.
So doctors, take good histories. Take good histories. But so someone comes to you, their child is having seizures. How do you confirm that this is epilepsy?
So it is clinical.
Okay.
Clinical is like what you tell me is what will convince me that this is epilepsy or this is not epilepsy. That's why I always ask a lot of questions.
Okay.
Yes. Sometimes people think we should do some tests.
Do some blood tests. Do something.
To tell you that this is epilepsy. No, we don't have such tests.
Okay.
Mm-hmm. But once we have clinically confirmed, based on what we have heard, based on the history, based on our examination, we think this is epilepsy. We do some tests. They don't diagnose epilepsy, but they help us identify the cause of the epilepsy, help us identify the type of epilepsy you are having, help us identify what treatment might probably work for you. So those tests that we do not confirm that it's epilepsy.
Oh, okay.
So sometimes you have somebody who says, my child has been having seizures. I went to this place. They asked me to do an MRI, but the MRI is normal.
It's normal.
Why? Why is the child still... Yes, your child's MRI is normal. It doesn't mean the child doesn't have
epilepsy.
So the MRI that will not diagnose epilepsy. Another common test, previously not common, but it's becoming a bit common now, is what we call the EEG, where we measure the electrical activity of the brain. You can have a normal EEG if you take 100 children who are having epilepsy and you do EEG for them. A third will be normal. So 33 of them will have normal EEG.
Wow.
Even though they still have
epilepsy.
Yes. So the EEG is not used to diagnose epilepsy.
Okay.
We rather use it to clarify the questions around the epilepsy and what drug might be beneficial for the patient. So there are tests that we do. The EEG is one, the MRI, the CT scan, sometimes some blood tests, sometimes we do genetic testing. Yes. These do not confirm epilepsy.
It's just so that you can find out why or what is causing
it, and then what drug will work better for the patient.
Good morning to you. So someone is saying that this of course it's an educative show. Thank you for doing the listening. Nelson Kwame saying that it's good information, and Faustina Boach is saying it's an educative show. Yes, we make sure that this show is educative. So if you listen to this show, you're armed with a lot of good information. SM Creative, I think like this month you are my number one listener. I'm saying that. So can I also say one of the reasons why people stay away from such persons is because if the person dies in your arms whilst trying to help, it is considered as you killed the person. Well, we have sudden unexpected death in epilepsy.
Yes.
But SM help the person. Help the person.
No. You have to help the person.
You have to help the person.
You have to help the person. Then you say that when there's an accident scene, you will not even go there because someone might die. And
they'll say that the person died in your arms.
So I mean, it's not common to have somebody have epilepsy and die there and then. No. They will die if they don't get. Rather, they will die if they don't get help. Yes.
On the helmets that I'm talking about, you see, and this came as a like a shock to me myself. I think I went for an event, and then I saw a child with headphones, like these very big, like industrial headphones to, remove the background noise and cut out noise. So I was curious, and I asked the mother. It's like, oh, the child is on the spectrum, so
yes, they can't tolerate
noise. Yeah. So I asked, okay, so do you take the child to school? He said, yes. I mean, the child goes to school, but
it's a structured environment.
Yes, and everybody is aware of these things. But sometimes people don't know these things. If somebody sees a child maybe walking here in the mall, a child's wearing a helmet, it's like, I don't know, it's a helmet.
Yes, so very recently, this is not more than a month ago, I think 3 or 4 weeks ago, I had a child brought to me by the parents because the teacher insisted that they should go to hospital and the child has been dropping. Okay, he sits in class and then he just drops. So that is a type of seizure we call drop attacks or atonic seizures.
Drop attacks?
Yes. So this child comes to me and I from my everything and from all the investigations, I realized these are drop attacks and I write medications. But to protect the child's head, I also ask them to get a helmet, and then they get a helmet for the child, and then they send the parents back to me that they should come and get a letter why the child should wear a helmet in school.
I was going to ask you about that because then you need to give them a letter as to why the child is wearing a helmet.
Make life so difficult for everyone.
Yeah,
make life so difficult for the parents. They have to come back looking for me to get a letter, and it's So slowly we'll get there. The education will sink, and then we'll get there. But sometimes we might see people with various things. Some of us are wearing glasses. Yeah. It's not for shaggy reasons that we are wearing glasses.
People think that is normal.
Yes. With time, we have come to take it that it's normal.
It's normal. Yeah.
So let's accept those that you might find who have to wear hearing aids, have to wear headphones, have to wear helmets. Let's begin to also accept that is their normal. Their normal dressing.
Yes. so that you don't.
Yes.
Because like for me, I think I'm naturally curious because I was like, no. There's something. Yes. Yeah. And then I got informed. I was like, okay. I think this is good for the parents.
Yes.
Do we involve, let's say, mental health people, mental health workers?
Absolutely.
In the management of epilepsy?
Absolutely. So epilepsy in Ghana, historically, we moved epilepsy to mental health services or psychiatry. Yes, even though it is not actually, in reality, it's not a psychiatric condition.
Yeah.
It is a neurological condition. But we moved it to psychiatry because first we didn't have neurologists or enough neurologists to be seeing the patients with epilepsy. So we thought that mental health practitioners can step in. Yes. But the challenge is that most patients do not want to go to the psychiatrist because they say, I'm not insane. Why do I have to? But the psychiatrist is not there for only patients who are insane.
They are there for all sorts of
conditions. Yes. So we still work closely with psychiatrists because of our numbers, because we can't see all the patients who have epilepsy, number one. And number two, epilepsy has a lot of comorbidities.
Okay.
Comorbidities are other conditions that are associated with a seizure. And a lot of these comorbidities are psychiatric.
Okay.
So things like depression, anxiety disorders, attention deficit and hyperactivity disorders, obsessive compulsive disorders, autism spectrum disorders. These are all neuropsychiatric conditions.
Okay.
Yes. And what is the sense in me making you come to me for management of epilepsy and then go to another person for the same for attention deficit hyperactivity disorder when the two are linked?
Yeah.
Why shouldn't one specialist treat the two? Yes.
Yeah.
Because that is the way to go.
All right.
In hospitals like tertiary hospitals like Konfanoche and Kolebu, we are beginning to start multidisciplinary clinics where the psychiatrists sit together with the neurologists to see this kind of patients. Yes, so that they are comfortable, that they are being seen at both ends. But yes, epilepsy still remains on the mental health table. And also in Ghana, we have a lot of funding for mental health issues. For example, some medications for mental health issues come in for free or at very low cost. Yes, so and some of these include anti-seizure medications. So we think that yes, we can let patients have the benefits of having these medications at decreased cost. That is why we still associate to a large extent with mental health.
Good morning to you, Oscar. Thank you for doing the listening, and your backstage contributions have been really, really, really good. And his concern is that he feels that for conditions like epilepsy, when somebody is diagnosed with epilepsy, he feels that everybody around that person needs to know that the person is epileptic in his mind. What do you think?
Yes, I agree. That is the ideal, that everyone knows. So let me take a child, for example. For a child, let's say a 12-year-old, it is important that the parents know that this is the condition, this is what we must do when he has a seizure. Which other environments is he likely to find himself? In school. So it's important that his teacher knows. His teacher, maybe, and then the head teacher know. Okay, in other places, everyone would know. But here, because of the stigma, the parents will tell you they don't want to. Even, I've had parents that tell me they don't even want the teacher
to know.
I mean, and I keep asking them, so if your child has a seizure in school, what do you expect them to do? So, and if it's as simple as that, it's not a problem. But sometimes when the teacher also knows, then, it becomes a barrier. There's this stigma. So the teacher also doesn't want to associate with the child and all that. So we all need to educate ourselves. So everyone must know. The teacher must know. If the child goes to a swimming lesson, for example, somebody was asking me just yesterday, his child is diagnosed with epilepsy. Can the child swim?
Go for swimming.
Yes, the child can swim. Okay, the child can swim. It's all boils down to supervision. The child has to take his medication very well, and then he can swim under supervision. Yes.
Like someone has to keep an eye
on him. And all of us, I mean, when you are swimming, somebody has to keep an eye on you. Okay. Yes. Somebody has to keep an eye on you.
Yes. Especially if you don't know how to swim.
Yes. I grew up along the coast, so we used to swim in the sea. But it's been a long time, so I will not.
You're not venture.
Yes, but somebody has to keep an eye on you, and then you can have normal activity. Sometimes we put unnecessary restrictions on these children.
Yes.
I've already talked about the food.
Yes.
The other thing is sometimes even education, we put unnecessary restrictions on them. I've had people who have to remain at home and not go to boarding school just because of seizures. But I've also had people who have gone to boarding school. I had one boy in boarding school, and he was on his own, very motivated. He took his medication, but occasionally, adolescents are a different species. Occasionally, he will abandon his medications for a couple of days. He'll get a seizure, and his own mates are the ones who help him, and then bring him to hospital. So at a point in time, I put one of his mates in charge of his medication. That keep checking him and asking him if he's taking the medication. So these are the people around you who must know. Yes, and then this boy did very well. He did very well when his mates were supporting him.
So it's not something that you should hide from the immediate environment of the child, or even of the adults. I mean,
yes, you can't hide it from them.
Yeah,
it's not helpful, because if he has a seizure, they are the ones who must help him. And if he doesn't have a seizure, they are the ones who must ensure that he's taking his medication.
All right. We're going to take a short break, and then we'll come back and we'll open the phone lines and continue this conversation. This is the Orange Health Lounge. My name is Dr. Jima, and you've been listening to Dr. Charles Hammond. We'll be back in a bit.
There's nothing worse than your perfect multi-bet missing. But there's nothing better than having it saved. Thanks to Betway's Bet Saver feature, you can win even if your bet misses. Even on multiple losses, you can get your bets back and more. Bet Saver, exclusive to Betway. Get way more. Terms and conditions apply. Regulated by the Gaming Commission of Ghana. No under 18.
Auntie T, abeg, fix me gobetete Ghana. No gari, no oil, no plantain, just beans then eggs.
Hey, brah, that be dangerous combination, no.
Problem no day. I fit handle am.
For Telecel, we the Bob say everybody gets what they like. That be why Made For Me bundles day. Based on your usage, you fit get your own data and call packages. Fala! Made For Me bundles like the way you the want them. Dial *530#, then buy Made For Me bundles today.
Telecel, connecting energies.
And we're back on Orange 107.9 FM. This is the Health Lounge, and on the break. So people can have multiple conditions along with epilepsy. So someone can be autistic, can have Downs, and have autism. Are these things linked in any way? So autism, Downs, epilepsy, are they linked in any way?
Yes, so in some way, yes, because especially autism and epilepsy, they are all disease of the brain. Yes, so I mean the same brain which has two different diseases, but they could be linked.
They could be linked.
Yes, okay. Sometimes the seizure could be the precursor of the autism, and then vice versa. And sometimes too, they could be two separate conditions existing in the same organ, but in most instances they are linked. Studies have shown that among children who have epilepsy, if you take children who have epilepsy and you take children who do not have epilepsy, the incidence of autism is higher in the group of children who have epilepsy. Okay. Yes. On the reverse, if you also look at children who have autism and children who do not have autism, the incidence of epilepsy is higher in the autism group than in the non-autism group.
Let me invite our listeners in to join the conversation this morning. You can call us on 0541 022 318 0541 022 318. That's the number to call if you have a question for my esteemed guest this morning. 0541 022 318. That's the number to call. 0541 022 318. If you've got any question to ask us this morning. We've been discussing epilepsy, and I really hope that we have all learned something. Nelson, we discussed the how to handle it in public, but we'll go through again. We discussed how to like the basic help to offer when a child or an adult is having seizures in public, but we'll go through again before we end the show, because I think it's something that people should just know. I think that's CPR. I think that's CPR. Right. People should just know. Okay, yeah. I think that's CPR. I think people should just know how to handle that CPR. I'm sad that we don't have Red Cross in the schools anymore. Okay, so we have a call. Okay. Hello, good morning.
Hello,
good morning.
Hello, morning.
Yes.
My name is Owusu Samuel.
Yes, also, can you please move away from the radio set a bit? We're getting some feedback.
Okay. Yeah, I'm calling from Amakum.
Okay, go ahead.
Please, can you explain things in tree so that our mothers will hear what you are saying. Because if maybe someone will not understand the English.
Okay, all right. Thank you very much for your call. We always do a cheese summary. Dr. Hammond is now a full cheese speaking a cheese speaking Ghana man. So we'll do some explanation in Chi as well. Let me pick this other call. Hello, good morning.
Well, good morning, sir.
Yes, your name and where you're calling from, please.
Yeah, I'm Philip. I'm calling from Ebuapa.
Philip, kindly go ahead, sir.
Please, can I? What is the medical name for Asram? Is it the same as Caesar?
Okay, the medical name for Asram.
Asram, yeah.
Okay. Thank you very much for your question. 0541 022 318 0541 022 318. Good morning to you, Professor Jikua Planju, from whom I first heard the word Assam. Well, is Assam the same as epilepsy?
No, Assam is not the same as epilepsy.
Okay.
Assam is a local term, or I would say traditional term among native Akans. They use Assam loosely to mean any condition which leads to failure to thrive in a child.
Okay.
So there are various types of Assam, and epilepsy could have one of those Assam associated with it.
Mm-hmm.
Yes, but epilepsy
is not the same as Assam.
Epilepsy is a stroke.
A stroke.
Or some would say a cha. Yeah. But Assam is used loosely to mean any condition that brings about failure to thrive. So you may have a child with a big head.
Mm-hmm.
Okay, call it Assam Puni or Assam Profre. That is because the child has either hydrocephalus or some other reason for the big head.
Mm-hmm.
That child could have epilepsy.
Okay.
But these are two
different
conditions.
Okay.
Yes, you can have Assam Brodijo, which often is a child who is wasted.
Okay.
Malnutrition.
Okay.
You can have Assam tomatoes. They have blistering.
Blistering.
Yes. So there are various forms of Assam.
Okay.
And the person was asking for the English name for Assam. No, I don't think we have one.
Okay.
It's a very local description of
various conditions
that have various names in English. Yeah.
All right. 0541 022 318 0541 022 318. Earlier on, you talked about the fact that epilepsy is, I even said treatable, but I say it's curable. How is it? How is it curable? Because that's what people want. We want to hear cure.
Yes, we also want our patients to be cured. Yes. So epilepsy, when you come to us, our aim is not to manage your seizures small. No, our aim is to make you seizure free.
Wow.
And I have taken many patients off medication.
Totally.
Yes, totally. And they are free. They don't come to me again because they have been cured of their seizures. Even
let me pick this call and then we continue. Hello, good morning. Hello, good morning. Hello, good morning. Okay, I think we're having some challenge with the phone line, but Oliver is here. He will fix it. He's my Mr. Fix It. Have you been able to sort it out? Okay, no, Oliver will fix everything. In the heat of mid-sem, he will still fix it. Yes. Hello. Good morning.
Good morning. How are you?
I'm well, sir. Yourself?
By God's grace, you are fine.
Okay.
Yeah, I have a daughter who of late suffers from something which, according to the information you are giving now, can be described as a seizure. We don't know. I don't know how to describe it. You know, she woke up early in the morning and then was with the mother and started stretching her legs. their legs become very stiff. Hello?
Yes, I'm here. I'm listening, please.
Yeah, the legs become stiff. And then he was out of himself, and then the pupil started going off.
Mm-hmm.
So we interceded by just praying for about 3 minutes as we just prescribed. She became okay. Then we took her to a nearby hospital, and a drip was put on her. She stayed there for overnight, and then we were discharged. Can it be described as a seizure?
Okay, Dr. Hammond is here. Yeah, he'll give you an answer. Thank you very much for your call. 0541 022 318 0541 022 318. So, boss, that was his description.
Yes, so it could be a seizure.
Okay.
Yes, it could be a seizure. But it doesn't necessarily mean the child has epilepsy.
Okay.
So you can have a seizure which is triggered by many different conditions. It can be fever, it can be viral infection, it can be head injury, it can be liver disease, it can be renal disease, and it can be anything. So all those things could trigger a seizure. But if you keep having seizures not triggered by anything, then we'll say that you have epilepsy. So, and again, it didn't talk about the child's age, but age is very important for us. And it didn't talk about whether the child had fever or not. These are all very important things, and whether it has happened before or this is the first time. Let me also say that there are many things that will also present as if you are having a seizure, but in the true sense of it, they are not seizures.
Okay.
So things like cardiac attack. People can have a cardiac attack and also become stiff and fall down and jerk and those things. It is not a seizure.
So for this listener, for instance, that the daughter has had this, has gone to hospital, what should he do next?
Yes,
should he just leave it like that, or
no? If it was unprovoked, for example, and it keeps recurring, this child needs to be properly evaluated and put on anti-seizure medication to stop it from recurring. Yes.
Okay. So if it's like this one, let's say it's happened once, they've gone to hospital, I assume that now the child is fine. Should they come and see a neurologist, or what should be his next step now?
Yes, so they should see the same person who saw them. I don't want to burden people.
Yes.
From looking for a neurologist. They can see any pediatrician if it's a child, or a physician if it's an adult, or even a family practitioner. Yes. So if it's just a one-time occurrence, you probably don't need to. But it depends on how bad it was.
He said it was for like 3 minutes.
3 minutes. That's not really bad. But some people can have just one seizure, but it can be so prolonged that you need to go proper follow-up.
Okay.
We don't want it to happen again.
Yes.
So we need to find out what brought it about and all that. Yes. Okay. So this child probably, from the first evaluation, we need to know what brought it about and how it can be prevented from recurrence and all that.
Okay. 0541022318 0541022318. And one of the good things I've heard this morning is that epilepsy is curable, and you've cured people and they've stopped coming to see you
a lot. Yes.
But then you're reducing your patients' numbers.
No, but more
people keep coming. So there are people that you've put on. So what is it? Is it medication? Is it surgery?
So there are various modalities for treating epilepsy. Medications are very common, and that's what we do most of the time here.
Yeah.
But there are some seizure types that also requires hormones.
Okay.
So we use hormones, and the most common hormones we use are steroids, and then also a hormone we call ACTH, adrenocorticotropic hormone. So we've done that for some patients also. Then for some patients, we also use surgery. Okay. Surgery is currently being advanced in the Western world. Slowly, it's not here yet, but slow. I think that very soon we'll start epilepsy surgery. Some patients have a structural problem in just one part of their brain, and it is causing them seizures every day. When you take that tissue, that abnormal tissue off, and it is not going to have any serious consequences on the patient, then that is the preferred treatment. You take that tissue off, and the patient becomes seizure-free.
Seizure-free.
Yes. And most of the time, it's people will say, "Hi, how can you touch the brain tissue? It will bring about weakness or something." Yes, those. I've seen a patient who had very bad seizures daily and multiple times in a day, and it was due to a focus in the brain that was abnormal. And when we said we were going to offer surgery, and that it might lead to weakness, he was still willing to live the rest of his life with some weakness on one side than to have seizures daily. So this is how bad seizures can be.
Wow.
Yes. But again, with advancement in medicine, those weaknesses that you are talking of, they often do not come. And even if they come, they are very minimal.
What is the value of diet change, like the ketogenic diet, which has been linked to,
the ketogenic diet is
epilepsy.
Is very useful
Okay.
in treating epilepsy. In other parts of the world, they do it a lot.
Wow.
Even in parts of Africa, we do it a lot. I have tried it here.
The keto diet.
Keto diet, yes.
Wow.
Yes. Well, what happens is that it is a diet which is high in fats, but low in carbohydrates and low or moderate in protein.
Okay.
So it is just when you take the ketogenic diet, it is as if you are in a fasting state. When you are in a fasting state, you are low on carbohydrates.
Okay.
And your body or your brain switches from using glucose to use what we call ketones.
Okay.
And it is known that when your brain uses ketones, it is not so excitable.
Okay.
So seizure frequency goes down.
Wow.
As compared to when your brain uses glucose. So the whole mechanism of ketogenic diet is giving you very low glucose so that your brain will switch to using ketones. Yes. There is and it works.
Okay.
So it's when you do that, it is just like you are in a fasting state. So some spiritualists will tell a person who is having seizures to fast. And you see that when you fast, you don't get seizures.
Yes,
it is because your brain has switched from using glucose to ketones. Yes.
Okay.
It reduces seizure frequency and also seizure duration remarkably.
Okay, that's good to know.
The challenge with the ketogenic diets in our part of the world is that our staples are all carbohydrates based.
It's not easy.
It's very difficult to remove carbohydrates
from our diet.
Out of our diet. And so it becomes very expensive if you want to go strictly keto. So either because it's very difficult to prepare at home a diet that is low in carbohydrates. Yes. So there is a already packed diet that if you want to do ketogenic diet, then you go for that one. That is called the Atkins diet or the modified Atkins diet, and it can be very expensive. How can you live your life on an imported
diet all the time?
All the time, yes. And so, and for it to work, you need to be very, very strict and not introduce carbohydrates into your diet. Carbohydrate has to be very low and a high content of fat, and that is why it is very difficult for us to do ketogenic diet. But those who have successfully done it, it has always led to decrease the seizure frequency.
Okay. Good morning to you, Dr. Eliotano. Good morning to you, and thanks for doing the listening. We are just a few minutes to run away from the studio and conclude our conversation this morning. On epilepsy. And I know people have learned a lot. From our conversation today. But if you are like Oliver, who was just mouthing to me LPM, and you like food, this LPM is just designed for you. If you're a foodie, Pomo tomato mix is bringing you the Pomo Mukasi Ra Challenge, and it's a battle of flavors. And we want you to bring all your friends, your squad, and come and enjoy a really, really good time. Good vibes and lots of fun awaits you. And then there'll be lots of delicious meals prepared with Pomo tomato mix at very discounted prices. And Pomo is one of the good brands, one of the best brands out there when it comes to the tomato mix market. Mark your calendars for these dates. First March, they're at, so today, they're at Aponchechi in Ejeso. 6th March, they're at Ike's Cafe in Bantama. On 9th March, they're at Confidence in Ahojo. And on 16th March, they're at Banners, also in Ahojo. All Pomo is saying is bring your appetite and come and taste the love with Pomo tomato mix. Is the Pomo Mukasi Ra challenge, and you cannot let this pass you by. Everything will be discounted today. That I just saw Aponchechi right from here. You will definitely find me there. So in wrapping up our conversation, Doc, on epilepsy, how should people amend their minds and their thinking generally when it comes to a condition that is so heavily stigmatized? I have had challenges because I do a lot of school health, challenges with parents arguing with it's not even diagnosis, like a proposition that this child might be epileptic. How should people change their minds towards this condition?
Yeah, so we have many non-communicable diseases in our settings. Hypertension, diabetes, cholesterol, and all those things. Epilepsy is one of the non-communicable diseases, and we have to see it that way. The whole world, there are 50 million people or so who live with epilepsy. In Ghana, it is estimated that 1 out of every 200 people has epilepsy. Okay. So it is something that we cannot shy away from. Yeah. Yes. 1 out of every 200 children. So if you are a school teacher, look at the number of children in your school. If they are 200, you are likely to have one child.
At least one child.
One child with epilepsy.
Wow.
And begin to think about it. If that child has a seizure in school, what am I going to do? So you must also prepare yourself. So the whole society needs to orient our minds towards helping these vulnerable people who may have seizures. Yes. So we have learned a few things today. 1, it is not contagious. 2, it can be caused by various things. Okay. And then 3, the fact that you have one seizure which is provoked by something doesn't mean you have epilepsy. But a person who has epilepsy has a tendency to have recurrent seizures. And when he has recurrent seizures, there are things we must do to help. Okay, we must protect them from injury. So if you can put a cushion under their heads, it is very useful. If you can put a cloth, fold a cloth or something under their heads, it can be very useful. And then you must move them from danger. If they are standing in close to water or close to fire, a lot of patients with epilepsy get burns because they had a seizure when they were close to hot water or something. You must move them away from those harmful environments. And then number 3, you must hold them, position them properly so that they don't hurt themselves. And the best way to position is to put them on their left side. Okay. And then number 4, we don't have to put anything into the mouth of the person who is having epilepsy, thinking they are going to bite their tongue. So you put a spoon or a wooden spatula or something. That is harmful. Don't also put your hand for any reason into the mouth of a patient who is having a seizure. They might amputate your finger. And then number 5, you must stay with them throughout the time of the seizure until they have recovered. And then finally, don't give them anything to eat or drink.
During the seizure?
During the seizure.
Okay.
Yes. It will not even help in any way. It might cause more harm because they might swallow it into their lungs instead of swallowing it into their stomach. And that can even lead to their death. And then finally, applying ginger, pepper, garlic, hot water, cold water, lukewarm water, turning them upside down, all those things do not help in any way. Some of them can be harmful to the child who is having a seizure.
Should children or should people who have seizures wear, let's say, a seizure bracelet, have a bracelet or
in the UK,
something?
It's common. So he has a bracelet or
a necklace that has
or something that says that I have seizures or I have epilepsy. When my seizures come, this and this and this are the things you can do to help me. Okay, or call this number, or this is my hospital, this is my doctor. In Ghana, because of stigma, we don't even tell the patient himself
that they are epileptic.
So most of the time I have parents who come to me with a child who is having a seizure, and then I will ask, have you ever had a seizure before? He will say no, or she will say no. It is only when the grandparent is around that the grandparents say, oh yes, when he was this, he had a seizure. Because we think
we don't even want to tell them.
No, we don't even tell them. So we don't even mention it. So even to the person who had a seizure, we don't mention it, let alone to a third party.
To a third party.
So that is how bad the situation is, and it's all because of the stigma. We think it is demonized, it is demonic, it is caused by witches or demons and all that. And that has also driven our health-seeking behavior to a large extent. We will go to do
all sorts of things.
Yes.
Someone was asking, why are anti-seizure medications so expensive? He's saying the good ones.
No, there are very good anti-seizure medications.
He actually mentioned
a brand,
but I'm not going to say it.
Okay. So the newer medications are always expensive.
Okay.
The reason the newer medications are expensive is because some companies have invested so much into discovering the molecule, and most of the time they have a patent on it. They protect it. I think they are protected for about 20 years. So they are the only ones who can sell it for 20 years, and it's assumed that within that 20 years they will make their
profit.
They will recover their cost and make some profit. And then after that, the patent is open, and then other companies can then have the molecule and then also manufacture it. So when you have one of those drugs that is coming from only one company, we call it an orphan drug, and it can be very expensive. Be very expensive. Yes, but there are a lot of anti-seizure medications that are generics that are not expensive, and sometimes people also have a very strong belief in brand names. You have a medication and they want to go for a particular brand. It's just like cars, you know. If you take any car, you get to a Joso, but sometimes somebody wants to sit in a very big one.
Someone wants a Lamborghini to a Joso.
Yes. Okay. So it's when we go chasing after the brand names, that sometimes it can be
becomes expensive.
Yes, but there are many anti-seizure medications that are not expensive, and the National Health Insurance also covers. I think I know about 4 anti-seizure medications
out of the 26.
Yes, so we still have a long way to go. If our politicians are listening, they should take that to note. We still have a long way to go. There are many children many people whose medications are not covered by the NHIS, and I think we should keep expanding the scope of the NHIS to cover a lot more of these medications.
And on that very good political note, we've come to the end of today's show. Boss, do you have any shout outs to give some people who have been listening to you this morning?
I want to say good morning to all my patients.
Yes,
especially those I see at Konfanochi Teaching Hospital, Tech Hospital, and then sometimes when I go and do my galamsey at Allen Clinic.
At Allen Clinic, all right.
Yes.
But on what days in Confanoche can people come
So
for
the
consults?
The child neurology clinic is on Tuesdays and Fridays. Yes, but because of the numbers, we book patients. So you need to get a referral and then get a date to come.
Okay.
Yes.
Okay. So you need to get a referral and then you get a date to come for
and
clinic.
and then when you get a referral, you either come there personally or you call, and then you are given an appointment.
Okay.
Yes. We often prioritize seizures because we don't want the child to continue
having seizures.
Yes.
Okay.
But again, the thing is that we can't see all the patients in one day.
Yeah.
So definitely we'll have to
get an appointment,
yes.
or see a pediatrician, or see a family physician, like I always say.
Yes.
See a
I mean,
family
there are
physician.
many pediatricians in Kumasi, in most of the hospitals in Kumasi, and even in the districts, there are pediatricians who manage your
and
child's
now with the family physicians, we are plenty.
Yes, plenty.
We are everywhere.
They will manage your child's
so please
seizures.
come and see us.
You don't need to come to
all the way to Cas.
Yes. So we want to leave the tertiary hospital to manage the complicated ones.
That's true. Yeah. That's true. All right. Thank you so much, Dr. Charles Hammond, consultant.
It's always a pleasure.
Consultant pediatric neurologist and an SMS alumni. For those who don't know, this year the medical school is 50 years.
Yes. I'm so proud to be a product of SMS. Yes. So I belong to the class of 2002. And
can you imagine how long it has been?
Let me say a shout out to some of my mates, Professor Adaminsa.
So you finished school in 2002.
Oh yes.
You finished medical school in 2002. Me, I entered medical school in 2003. Oliver, when you do?
No problem. Someone is also coming.
Someone is in first year. Wow.
So Professor Daminsa, the chief executive of Confanoche, is my classmate. Dr. Kujo Sabin, the medical director, is my classmate.
Okay.
Yes, I have a few classmates in Kumasi. Staccato, Meketengs, Dr. Tukwansa, Dasa, Abacha. I'm saying a shout out to all of them. And even the names I have not mentioned. Dr. Felicia Diopa at Offenso is a medical superintendent at Offenso, St. Patrick's Hospital. It's my classmate.
I see. That is SMS 2002.
Yes.
They finished school some 23 years ago. So you can imagine.
You are making us look like ancient of days.
Good morning. Good morning to all alumni, and we will see you very soon. Follow the School of Medical Sciences page on Facebook for all your information. And I'll definitely host them here as the launch gets closer. That has been our show for today. I'm back on your radio next week, Saturday, from 8 a.m. to 10 a.m. My name is Dr. Kwesi Jima, and I'm your host here on the Orange Heart Lounge. Enjoy your Saturday and stay safe. Bye.